All right, I want to answer your question about the case study module questions and how you respond to it then in the discussion board. So I'm going to click on modules here, and I'm going to open up week 2, and I'm going to open up the content folder, and we're going to zip here to the case studies. Okay? All right, so I'm assuming that you're in group 3. So here's your case study. You're going to use your book to answer these questions and use your own interpretation of what the book says as far as assessing the learning needs. You're going to identify who the learner is and all that good stuff as covered in your book. So then we're going to go out. So you are answering that on your own and answering it to the best of your ability. And then you go to group discussions. And again, I'm assuming you're in group 3. Yep, there you are. And what you're actually posting in your discussion board here is kind of a summary of your answers, and you don't have to list out each answer, but you can list out, like, identify the learner as the intubated patient or the student or whoever you decide is your learner. And then you're going to look at how realistic this is to use a learning assessment in your practice. So what the book discusses about doing learning assessments, if you have an intubated patient, is that realistic to do, or wherever it is that you work, whether it be, Helene, I can't remember off the top of my head where I think you work in ortho. But again, looking at where you work and if this is realistic. And then just those are actually just those 2 questions are what you're answering here. And then in your third is with your peer responses. When you're responding to your peer, make sure that you're noting the difference in your learner assessments, because you're all would all be doing the same case study, that case study number 3, and see what your differences are. So there's not exactly right or wrong answers. There's just your interpretation of how learning assessments are done based on your understanding of the book, and then how you're applying it to the case study. I hope that helps, and if you have any other questions, don't be afraid to ask me. And I hope this auditory helps, just hearing it out loud. I think you might be overthinking it a smidgen and making it a little bit harder than it has to be. So that's my points of advice.